Hello everyone, my name is Sanita and I will be presenting about changing healthcare, particularly in demand for telehealth or also known as telemedicine. Telehealth has been around since before pandemic, but it came to public knowledge when pandemic happened in 2020. Due to overburdened healthcare system, the demand grew. According to Ben's 2024, telehealth is a way to receive healthcare services remotely through electronic devices like your computer, tablet, or smartphone. Telehealth services came in different forms, such as live videos or audio appointments, secure text messaging with your healthcare provider, or remote monitoring devices that allow your healthcare provider to track things like your blood sugar. The pandemic pushed the government to adapt and increase awareness around telehealth, and telehealth practices were adopted by Alberta government on February 25, 2022. How telehealth has lots of benefits, and part of the services that can be provided are the following. It allows to see multiple doctors or patients at the same time. It allows to share photos of any concerning body changes like rashes, allows directly messaging, emailing, or calling healthcare providers, provide video instructions how to use medical devices or self-injections, can remotely monitor blood sugar, health rate, and many more, providing you immediate, secure access to electronic health records, linking to specialists immediately if treatment is needed. And even as part of future development, healthcare professionals are exploring a way for surgeons to perform remote robotic surgery called telesurgery for conditions like kidney tumors. Few immediate consequences are that the telehealth improves the delivery of healthcare during the pandemic, minimizing COVID-19 transmission and potentially reducing morbidity and deaths. Less people in emergency rooms and seeing doctors in person. Lower no-show rate. Need for technology like smartphones, computers with access to the internet, and faster way to access medical services. Waiting time decreased to see a doctor. Following are the impacts of those consequences. One of them is federal and provincial government need to modify and accommodate telemedicine policies. Different provinces and insurance providers have different regulations and restrictions when it comes to telemedicine. For example, health insurance companies or health benefits providers may not cover telehealth services or only certain types of services. Another impact is people who live in rural or isolated areas have accessible healthcare, which they did not have before, which also reduces carbon footprint because they don't need to drive those long distances. They just can talk to the doctor through the devices. Flexible hours. People who have busy workdays and cannot get to the doctor in the normal work hours can have access to medical services after work hours. So, for example, if you need to go see a doctor, you need to take half a day off or a few hours off. It's at your own expense, and plus your traveling time. It can be quite costly. Relief overburden on health system and less waiting time. More patients can be seen online than in person. Reduce hospitalization. Telehealth may lead to reduced hospitalizations, in part because people can access care earlier before severe symptoms develop. Cost effective. Generally, telehealth appointments are less costly than in person because more patients can be seen in the same time frame with fewer support staff. Beyond the actual out-of-pocket costs, research indicates telehealth can offer additional cost savings such as less time off work to see a doctor and less travel expenses, as mentioned before. Resistance. People are resistant to a change for the following reasons. Cost. Cost of having required technology and certain medical devices. That can be costly. Phones are quite expensive. Same with laptops. Quality of care and limited services. Limitation as to what can and cannot be done via telehealth, such as providers can conduct a physical examination. There is also greater risk of misdiagnosis associated with telemedicine services. However, there are different devices, but they are costly that you can purchase. And also, lots of people sometimes just prefer more in-person care and trust more when it's in person with doctor. Tech savvy. Some people are not tech savvy, especially older generations. Security of private information. Data security can always be guaranteed when using personal or public Wi-Fi, which means sensitive health information could be accessed by third parties. Some people do not have access to private spaces where they can use telehealth services to have extra security that nobody else is hearing them. The adoption and impact of virtual care is influenced by a few internal forces. Overburdened health system, especially during pandemic, requires a change. Not enough doctors due to high demand for healthcare requires a change. Organizational structure can't support all the demand, therefore needs to be a change. Health information systems are available for use in health organizations like Connect Care. Some of the external forces that influence the change are pandemic, the need for remote healthcare. Then, according to Government of Canada, 2023, from 2016 to 2021, the population of Canada increased by 5.2%, and they predict that by 2068, more than 1 in 4 people will be age 65 or older. A growing older population will lead to increased health issues and demand on the healthcare system. In addition, 1/4 of Canadian population were immigrants in 2021, which also increases demand for health services. Geographical. Traveling distance for patients, especially in rural areas, are expensive and time-consuming that can be reduced by using telehealth. Social technology is developing globally and more people adopting to technology use and are more used to get things more faster, and it's much easier for them to use the technology. In conclusion, there have been internal external forces like pandemic, growing population, geographical, social, and more factors that require the change in demand for telemedicine. Telemedicine allows people to see doctors with the reach of their technology devices, which allows much more flexibility and accessibility. However, there are still few challenges like acquiring technology, trust, and security of private information. Thank you for listening.